contribution through the UN ODC office. You will be pleased to hear that at the opening of the center, Imperial Bank donated 10 sewing machines and the TSS group of companies gave 5. In addition, through the first of many NGO corporate partnerships with the Mabati Group, we operate their HIV/AIDS VCC center at their factory in Mariakani. Ladies and gentlemen, we are very privileged that James Mwangi, the CEO of Equity Bank, is in our midst. The accolades that Dr. Mwangi and Equity Bank have justly collected are too many to mention. Equity Bank has taught us that it is possible to deliver financial products to the poor profitably and in a way which transforms lives. There is a lesson in that for institutions like Bomu. We hope to be able to deliver health services in the transformative way that Equity Bank has delivered financial services to the poor. To this end, we will be seeking the partnership with Equity Group Foundation to drive this endeavor. Ladies and gentlemen, the government of the United States has been our foremost steadfast supporter for decades. Without that support, Bomu would have remained but a twinkle in our eyes. We are a direct recipient of funding and a prime partner of CDC, the Center for Disease Control, represented here by Dr. Nancy Knight. Mr. Ambassador, we are privileged that you took time to come and meet with us in Mombasa and that you agreed to grace this occasion. Mr. Ambassador, Dr. Knight, Bomu, and more broadly, the people of Kenya are indebted to you. Your support and that of your government means more to us than you could imagine. Our work has also been helped by significant private and corporate donors. Global tea and commodities continues to assist us greatly. Kanubai Babla over the years has supported us in numerous ways. Keshubai Patel of Corrugated Sheets has never refused to help Bomu. We also have the support of Mohsen and Fawzia Jaffer Foundation for our orphan feeding program. I'm also very pleased and honored to share with you, ladies and gentlemen, a very, very good news that Baburi Cement Limited have agreed to partner with us in giving us their prime 5 acres of plot, not far from the cement factory in Baburi. Where we hope to establish a state-of-the-art medical facility. To those donors whom I have not mentioned singly, Bomu will always remain indebted to you. Ladies and gentlemen, sometimes one appoints consultants and after the assignment is completed, one is left with a feeling of whether it was money well spent. Atom, where are you, Meruka? Atom, represented here by Martin Meruka, Maxwell Otieno, Atia Walid, and Damaris, have added significant strategic value in helping us define our strategy, our mission, and our vision, and guiding us in relationships we are creating. We regard them not as our consultants, but as our true and faithful partners. I will end with a final appeal. Our work at Bomu requires your constant support. Sir, we require your constant support. We endeavor to be self-sustaining and are making considerable strides in this regard. However, we also operate under a simple but fundamental principle. We will never turn away the needy. Our principles were fully tested recently. During the recent strike by medical doctors, we were seeing close to 1,400 patients daily, double our number. Many of them had no funds, but consistent with our principles, we treated them for free at significant cost to Bomu. I believe that this philosophy must be cherished and protected, and for this we need your continued support. I can assure you beyond any doubt that the shilling given to Bomu, is a shilling worth spent, and not a cent goes astray. To this end, we shall soon be launching an initiative and campaign dubbed Champions for Health. Champions for Health will be the vehicle and a platform through which like-minded institutions can join us in our ambitious purpose to provide access to quality healthcare for all. Please look out for Champions for Health initiatives. It is my sincere hope that you will join us in this noble journey. Friends, Bomu's success and recognition comes from the loyal, dedicated, and uncompromising staff. This surely is also a blessing of the Lord. To each one of them, I convey my appreciation and a prayer in the new year to bless them so that the mission of Bomu stays alive. Ladies and gentlemen, I would like to mention Bomu's administrator, Mr. Abdul Baga. Where are you? Yeah. And his team, who have worked over weeks and months to see Kibera complete, which they did. I would like you to recognize them and please give them a round of applause. May the Almighty bless you all.
I'm Jumbo. Mambo. And Mama, I need to tell you something. Ni Minnesota, lakini ye ni sanko. Ikiuliza yeye kwa pesa, hapana mimi. It's really wonderful to be here. This is a great occasion. It's a very special event, and it is a very important milestone in delivering health care to Kibera. This is one of the biggest healthcare programs in the Nairobi province. And it's really a pleasure for me to see another organization come here and add more capacity. You know that every hour in Kenya, a mother dies of maternal causes. Every 4 minutes, a child under 5 dies. Every 20 minutes, a newborn dies. Every 8 minutes, somebody with HIV/AIDS dies. 10 minutes, somebody dies in a road accident. This is much too high. Kenyans are much too precious to have these terrible statistics continue. This hospital here is proof that together we can make a difference. And I thank Bomu Hospital and Anuka because more than 500,000 people are going to get quality health care because you've decided to invest in these people. And that's what I really liked about this hospital, because when I walked in, I saw a patient's bill of health. And as I walked through the hospital, I saw that they were providing comprehensive care, nutrition services, child welfare, maternity, and HIV interventions unlike any that I had really seen in Kenya before. We're committed to working with Bomu. We're committed because I know that we can dramatically decrease the fatalities associated with HIV/AIDS. You know, the Langata Youth Network and Bomu and the Nuka Trust, your collaboration, your innovative approach to healthcare is really an example for all of us because you're making a difference for the neediest people in this area. Those 5 containers are not just 5 containers. They're an innovative approach, creative problem solving to making a difference in the lives of so many Kenyans. This is an example we should all follow. This is an example of communities, of NGOs, of leaders making a difference. Well done. Thank you. Asanteni sana.
What His Excellency the Ambassador enumerated here was not the statistics. He was talking about lives of people. A life of a child being lost every day, a life of a Kenyan being lost every 8 minutes. Those are not the statistics. It's me and you occurring to us. None of us would love to live before our time. So let's join hearts and support Bomu and do what needs to be done. I'm very proud of Mrs. Awanjawala because when I went there, this became the only organization that I saw we shared word for word the purpose of our organization, the mission and vision of our organization. Yet one is a bank and another one is an NGO. When you talk about success, success is what we see in Mrs. Ajawala. Putting smiles in children, winning the trust of intelligent people like us that we are assembled here today because of our work. That is what is success. I want to call upon all of you to give us a hand so that during our lifetime we can give the poor and Medistas good health care. Thank you very much.
Miss Josephine. Look carefully at what she's wearing. Let me know if you can tell what the dress is made from. Yeah, John. Round of applause for Josephine, ladies and gentlemen. The dress and the fan are made entirely with colored condoms, ladies and gentlemen. Give her a round of applause. Next up we have Miss Sophie. Round of applause for Sophie in the green and the black. Round of applause for Sophie as she exits, ladies and gentlemen. Next, coming down the condom walk, let's give her a round of applause to Edna. Pink, yellow, and blue, ladies and gentlemen. The outfits were made by Faiz Luhar. Round of applause for Faiz. This is Faiz right here, ladies and gentlemen. Ladies and gentlemen, the professional models you see here are all staffers of Bomu, working in different departments. Give them a round of applause. I'm going to ask the three of them to come down the catwalk one more time. Josephine, Sophie, and Edna, one more time. Round of applause, ladies and gentlemen. Bomu distributes 500, I beg your pardon, 500,000, I was close, condoms every quarter, ladies and gentlemen, 500,000 condoms every quarter. Pokeeni salamu. He brought them in from the US. His main concern was what they were going to say at customs. Because you can imagine them there. Ebu mse tafadhali fungua hii suitcase. Sasa. Ebu Wafula. Ebu njoo hapa. Huyu mse ako na mipira ka 5,000. Even at one a day. That is over 10 years. Find the guy, ask him, hey, mambo vipi? The usual, nani bwana. So ladies and gentlemen, give a round of applause to the models, the designer, and the brave soul who traveled miles and miles with 5,000 colored condoms. Ladies and gentlemen, round of applause.